Hello, Dr. Dayanayev here from Steinway Family Dental Center. We get a lot of questions about implant-supported dentures. So today I'm going to answer some of the most common questions we got this far about implant-supported dentures. The first question is, what are implant-supported dentures versus traditional dentures? The difference, well, first of all, the word denture implies that something is foreign in the body, right? So it is something that replaces the teeth. And it could be removable, something that you yourself can take out of your mouth, or something not removable that stays in there all the time. So how does that compare to a denture? Denture without implants, it's always removable denture. You take it out, right? I mean, you can get fixed bridges, but that's bridges, not a denture. So now we're talking about the difference between implant-supported dentures and dentures. Now, implant-supported is something that can, let's say, click to the implants and it will stay there, and you would have to unclick it to take it out. I mean, it's still a removable appliance. You still take it out yourself every day, but at least it holds much better. How does implant-supported denture works, and what is the process start to finish? Well, first of all, you would need to have the implants, right, that they would support the denture. And then the denture would be fabricated for that, and there's a piece that connects to the implants, and the implant have the male part and the denture will have the female part, and they go and click, kind of like the clips on your jeans, right, or on your coats that have clips on it. So that's how it works. It clicks right into it, and then it holds the denture in place. And you can eat on it, you can smile, and it doesn't fall down. What is the difference between snap-in dentures and permanent denture implants? Like something that is implanted already and you don't have to remove it at all. In other words, you cannot remove it. It's basically implants, and then the denture is screwed into those implants, and it stays there permanently. That is the difference, basically, that the removable part of it is the denture that you can take out of your mouth and keep it in water overnight, and then in the morning you would click it back in. The screwed-in prosthetic device would be screwed in, and you cannot remove it yourself. Your dentist still can, but you wouldn't be able to. Who is the good candidate for implant-supported denture? Usually it's people who don't have any teeth, and they have been using a denture and they tired of this denture is falling out. It's just not holding. So they need a little bit of support, or a little better support for their denture, so it stays in rather than fall down every time they smile. Or those that are using the adhesive cream that is like a glue that holds it in, and they don't want to use the glue anymore. Those are the good candidates. Now, there are also people who cannot afford something that is screwed in and non-removable thing, because it is less expensive to get a denture that clicks to the implants and holds, rather than something that screws into those implants and holds it there. What are the benefits of choosing implant-supported dentures versus traditional denture? Well, the benefits is that it's going to hold much better, right? You're going to be more confident that it's not going to fail you in the middle of the meal or in the middle of the speech. There are some movies that I've seen on the internet that people start singing and the denture just flies out. Of course, there are better ways to use the denture if you have implant-supported dentures, because those things just don't happen to people like that. It is much more comfortable to use them when you have implant-supported denture rather than traditional denture. What should patients expect when they're getting implant-supported denture? Well, they should expect that there will be a little bit of the training time, like kind of you have to get used to having something like that on and know how to use it. So don't think that you got it and that's it. Now you can. There's a little bit of the period where you have to learn how to use your new prosthetic device. But other than that, you can eat pretty much anything you want. There's still maybe a problem with chewing gum, because it's still like more difficult to chew gum. The gum will stick to it. But other than that, there's really no restrictions to it, and you can use your dentures for anything. And it is very supportive, it holds very well, And also for your speech, you can actually speak with it, not worrying that you have to catch your denture during your speech. Are there differences between upper denture implants and lower denture implant? Well, the only difference is the type of bone that we have on the top versus the type of bone that we have on the lower jaw. But other than that, the way the denture works is exactly the same. And with the implant supported denture, like when you have a full denture on the top and it's a regular denture, not implant supported, your palate is covered. With the implant supported denture, it doesn't have to be covered, so you still taste your food better, right? The lower denture never really goes across because the tongue is a moving subject there, so you need a space for your tongue. So both of them would be similar, but it holds better on the bottom when you have implants to hold it down. What should patient look for when they're looking for a dentist that can do that for them? Well, first of all, you want to know that the doctor has experience with doing something like that, and also that it is in the same place, that there's a surgeon that can do the surgical part and the prosthetic doctor who can do prosthetic part. It is all in the same place. It's just the communication is much better when it's in the same office. Not to say that it's impossible to do it when they're in the different offices, but when they're in the same place, it's just easier for the patient and more convenient because you're only going to the same spot. I hope I've been able to share some light on this particular subject, but if you have any more questions or you want to know what it would cost for you personally and so on, how it would work for you or would not work for you, if I didn't answer your particular questions, you can give us a call at 718-728-3314 or find us online on alldentalneeds.com and request an appointment, and I'll answer your questions personally.